Hey, traveling with the Gradowitz and Geoff Emery and all the gang here on a nice Monday morning. Always good to be with our friends out there, and we've got some good things coming up, don't we?
Oh, we have some great things coming up. We got 2 more shots at Daytona, which is the getaway for the KUZZ 400 coming up the 4th of July weekend.
Yeah.
And then we have an in-studio guest. Of course, thanks to Mark Chestnut for dropping by. He'll be here on Thursday at the Palace.
Yeah.
And let me just tell you how fun the 8 o'clock hour is going to be.
Oh, this is going to be fun, you people.
I have my hand right now on a sample of a butt implant.
Yeah. Or a hind implant. I guess
Is there a clean way to say this, Doc?
Gluteal implant.
Okay, there we
That's
go.
what we technically call them.
That is what I like to hear right there.
Now, do I say your name correctly? Is it Lehocky?
That's correct.
Okay, from Butology.
Right.
Oh, this is great.
We'll be chatting about lots of stuff.
Yes, all the stuff. This is fun. I've never seen one of these before.
I had neither. I thought it was some sort of like stress, like a stress ball, because you can squeeze on it.
It's not a stress ball.
Well, it sure works well for that.
And doctor, is there any therapy for him that he will not unhand that that implant?
I agree. It seems like he
took
won't give
to
it
it.
up to.
Yeah,
I'll give it back.
That's what I'm thinking.
Sorry.
Yeah, he was looking at you like, give it to Steve, the older guy, because I can handle these. Well that's a bad way to put it, isn't it?
Yeah, always be wary of a cosmetic surgeon who comes in bearing gifts. You never know what you're going to get.
I tell you, my gosh. Well, we're going to be having some fun here right after the 8 o'clock hour, so stick around, my friends.
What are some myths?
KUZZ, good morning.
Well, good morning, guys. This is Sprinter Pam calling.
Hi, Sprinter Pam.
You're not calling to gloat about your $10,000,
Yes,
are you?
I am.
God, I knew it. Did you at least buy everybody a round of drinks or something?
No, but I got pretty feisty.
Did you?
Now, was the biggest thrill of that night not only winning the $10,000 but hanging out with Jack?
Oh, my goodness. Jack Ingram is awesome. He is just an awesome guy, and he is so personable. It's just unreal.
That was very cool. I love the look on your face. It's like, what? I won?
I didn't even hear. I was so out of the zone whenever you got down to the last 2.
Yeah, because I noticed that you and the other lady were just like, you're holding hands, just like praying with each other.
Exactly. We're just like, well, congratulations, good luck, and then we just thought when Jack said, wow, it's like over, he's like, I'm sorry, guys. And we looked at each other, we both started to walk off. And then when you said my name and said that I won, I was just totally dazed. It's like, that doesn't happen to me.
I have a great idea what you can do with that $10,000 because we have with us a doctor this morning who can take that $10,000 right out of your hand. In fact, he showed us something we've never seen before.
He can take it out of your hand and put it in your butt.
Yeah, he has. Well, she doesn't need that. She's almost perfect, Pam is. But yeah, we're looking at a butt implant right now, and we'll be talking to him here in just moments.
It's really cool. It's more like a stress ball.
Jeff, quit touching that.
I don't need that, okay, guys?
No, you don't. Okay. Well, good to hear from you, Pammy.
I wanted to say thank you so much for everything. That was the best day that I've had.
Oh, you bet.
In a long time.
We're glad you got it.
So much. I
you
appreciate
got it, baby. Thank you.
Okay.
It is a sweet thing. It's Keith Urban on KUZZ, the Gradowitz, Geoff Emery, and all of our friends just moving through a Monday like we had no better sense at all, which we don't, do we, Geoff?
No.
And we have guests in the studio this morning. This is going to be fun, I tell you, because we've been waiting for him to come in for a long time. So would you like to introduce our guest?
Dr. Brett Lehocky is here from Butology. Cosmetic Surgery and Laser Center. Welcome, Doc. This is going to be a fun hour, I think.
Well, I hope so.
Yeah. Well, we've been waiting for him because your specialty. Now, I was talking to him off the air. He was originally from Indiana, so he said he came to Bakersfield. It's like being in Indiana. He said just the nice people they met back here. We're about the same type of feeling, isn't it?
Same type of people. Just no snow out here.
No snow, which he likes.
That you missed that, right?
Yeah.
I don't miss snow a bit.
Yeah, I don't either.
He was at Loma Linda University and in pediatric work with the children with deformities and things that have happened to him. So he's done the entire gauntlet from that all the way into cosmetic surgery. Very nice fellow. Movie star looks, don't you think?
Sure.
So You're so jealous.
I didn't want to be uncomfortable and say that, but I guess,
See, one man can say that about another man without losing your identity. I'm just saying that, this is the guy.
The fear that we all have is he'll cover ground that we don't necessarily want to cover.
Yeah. I go to places that you guys are just afraid of. Let's just say it like it is.
You can chalk it up to age. I don't know what ours is.
Well, I think it's a good advertisement. If you're doing this kind of surgery.
Well, yeah.
Yeah. I mean, and you meet a guy and you say, my gosh, okay, there's a walking testament of it.
Now, you're over there with Dr. Shaw and everybody. And
correct.
Do you guys ever just sit around and go, you want to tweak that nose while you're here today? It's like, sure, what the heck?
Well, we try not to talk about that among ourselves.
Just a little shop talk, get out of hand. It's like, give me a scalpel. I'll take care of this right now,
Now, each one of the doctors we've talked to is specialized in a different area.
That's correct.
Right? Now, tell them your specialty.
I specialize in faces, and I specialize in the backside.
Okay, so you got the face. So any type of facial surgery you want to do.
Right. Change your nose, look younger with your eyelids or with your face, like with a facelift.
Uh-huh.
And I do the butt enhancement, let's just say.
Yeah.
There's a variety of different things we do for that.
Yeah, and that's becoming more and more popular. I think, originally when people would talk about cosmetic surgery, it was like almost where they'd go on TV, it was like they had uncovered someone that had cosmetic surgery. But then, now that it has become so popular, people realize for all the things that you felt funny about in your life, why can't you go in and have those things redone? People didn't used to do it. Now they're doing it.
And it's part of the whole baby boomer culture.
Yeah.
That the people who are baby boomers, and technically I'm tail end of the baby boomers myself, we just don't want to get old. You feel the same when you're 60 as you do when you're 30, and you want to look as close to that as you can too.
And see, a lot of the stuff that you guys are doing now, it isn't just, because when you say somebody had plastic surgery, it's you envision somebody who had this horrible facelift gone wrong or maybe these giant things hanging off her chest or something like that. A lot of what you guys do is almost necessity. For instance, if a lady's having severe back pain, you get a breast reduction. Maybe that's the thing. Maybe you got a moles in the wrong place. You get rid of that. So a lot of it isn't all just the vanity stuff anymore.
That's right. And a lot of things we get, at least that I get in the office, especially with facelifts, is people will say, well, I don't want to look like so-and-so because, they look weird. Mm-hmm. And a lot of it is just because they've had too much done. That's what I think. The celebrities, they have a lot of money and they have a lot of desire and they just have one too many procedures done. Most of the time, what we do for a first-time person, you're not going to have these kind of strange looks that you see on some of the celebrities.
Right. That's fair. Well, I'll tell you what, we're going to take some questions. If you have always wanted to know something about doing cosmetic surgery, he does all the face and the hindquarters there. Butox, as it were. Yeah, I like to think of different names for it.
Well, I'm still digging the sample implant that he brought. I still think
your hands off the sample
stress balls because this works great.
But this is a chance to get your free consultation. So you can give us a call at 842-5555. We're taking questions.
Thursday, July 22nd.
KUZZ, good morning.
Hey, I want to ask you guys a question.
Okay. Yeah.
What is a partial facelift?
A partial facelift probably refers to what I would call a mini facelift. And one thing you have to know about facelifts is there isn't just one procedure. This is what I tell people. When I think of doing a facelift, I don't just do one surgery for everybody. There's a variety of different surgeries that one does depending on what a person needs. So one wants to balance the surgery that you need to look good, because the important thing is to look good, but you want to balance that with the amount of surgery so that you heal quicker. So half a facelift, I would think it'd be called more of a mini facelift.
Okay.
But you look terrific, by the way.
Yeah, what are you worried about?
I have my whole body redone.
Oh, you're perfect, you gloating girl, Linda. Okay, that's my girl. They're always interesting questions. I've never even heard of a half a facelift, so that could be like from your eyes up, like a forehead,
or one side of your face, I guess, if you wanted a half one.
So you've seen probably all different types, huh?
Right.
I didn't even know there existed a half a facelift. I say, hey, if you're going to do it, do the whole thing.
Yeah, maybe you only need just a couple of things done. Dr. Brett Lehocky's here from Butology. And now when you mentioned when you were at Loma Linda working in pediatrics, is that type of thing where if we have a youngster with cleft palate? Is that the kind of stuff?
That's right. That's what my specialty was, that I did quite a bit of cleft palate work there.
Now, is that a number of surgeries to take care of a child who may have that? Is that
yes, oftentimes it is more than one. Generally, we like to say it's 4 or 5, between when they first start to when they're finally done, when they're an adult.
Now, is that a surgery that has come along in the past few years? Has the results gotten better? Or is it still something that's a little tough to battle, but you do what you can with it?
The cleft palate surgery or cleft lip and cleft palate surgery, there are some things that are traditional that haven't changed, and there's other aspects of it that has changed over the years as some new things have come about. And that refers to really all kind of the birth defect or congenital surgeries that we do. There's always some things, just like cosmetic surgery, there are some things that are traditional that never change, that are fundamentals, and some things that change along with time.
You know, I'm curious, when you do, because we're talking about cosmetic surgery this morning, and our doctor does facial surgery, and the posterior or butt implants or whatever that was becoming very popular.
PH to those of us in the business.
What is the most common facial surgery do? Is it eyes? Is it nose? I'm just curious.
The most common one is upper eyelids, but one has to remember that when we're talking about the face, we don't generally just age in one part of our face.
No.
So really right behind it is a facelift that involves changing the whole face and making it look younger. And the eyes are involved in that, or eyelids.
Pulling the skin back, tightening it,
right.
And everything. No, that's interesting, because, see, I did mine with clothespins. It never held. It just,
you went to the doc that treated you like a Shar-Pei when he did that, too, so.
He did bark at me, the guy that did. Yeah, we'll be right back. If you have questions for our doctor, give us a call, 842-5555. It'll be with us a few more minutes, and you can get all that free advice you've always wanted. KUZZ, good morning.
Good morning. Is this KUZZ?
Yeah.
I have a question, please.
You betcha. Go ahead.
Okay. I have lost 41 pounds, and my face is saggy, and my goal is another 20 pounds. Do I wait until after I complete my 20 pounds?
Well, first, congratulations for losing the 40 pounds. And believe it or not, that's a great question, and I get it all the time. And what I tell people is, when you're talking about a face, losing weight after that is really nothing that you have to wait for, because when I do a facelift, I'm taking that extra fat out from underneath your skin anyway. It's totally opposite as if you're having a tummy tuck or a procedure on your body. Those procedures, we want you to lose as much weight as possible.
Okay.
So you could go ahead and get this done now.
Go ahead and get it done.
Okay. And one more question, please. I had the upper eyelid surgery done because I couldn't read. They'd fall all the time. But I feel like the eyelid is coming back. Can that happen?
Absolutely. In fact, that's the most common cosmetic surgery procedure that I see that is done for a second time. It's just because our upper eyelid skin is so delicate that over time, being out in the sun, you get some loose skin because it loses its elasticity, and with time, it just returns.
Okay. I thank you so very much. I appreciate your answers.
Thank you.
Bye-bye.
Bye, hon. It's Josh Turner, probably the most fabulous voice in all of country music. That's his latest, called All Over Me. The Gradowitz, Geoff Emery. And, of course, all the questions for our doctor this morning from Butology. And, man, we have covered some ground. We have all the way from butt implants. That just doesn't seem like the word. Tush implants. Hindquarters.
Yeah.
Now, you call them...
Gluteal implants.
Gluteal.
That's what we call them in our literature. It's gluteal implants.
Oh, gluteal.
Okay. That's the plastic surgery proper term.
But the layman's terms is butt enhancement.
Butt enhancement.
Let's just go ahead and say it.
And it's becoming more and more popular. We were talking this morning. I know a lot of people, it's like all of us. I'm not ashamed of anything. I mean, anything I'd done, I'd probably have it done on the radio. You know what I mean? But,
cutting his hair was one thing for charity, but
yeah, they cut off all my hair.
What are we going to do now?
But,
oh, God, no.
This is marvelous. Now, one thing I think that we haven't covered, which we might talk about, is a lot of people say, well, how much is it? Well, that's something you want to find out with a free consultation, but it really isn't all that outrageous. And there's financing in many cases.
That's
amen?
Correct, yes.
Yeah, which I didn't.
Most people finance their surgery.
Oh, they do. See, I always figured these people just had a bunch of cash in their hand and went down and had it done. But so there's financing and all those things you can call and check on. And, what's that?
I don't know why. the strange thoughts that come into my head, and it's like, no, I'm still paying on these, Yeah. It's just, I don't know.
Do you have to say on these as a multiple? Yeah. So,
or it would be a that if I just, got the butt implant or something. Is a butt considered one?
Well, there's 2 butt implants.
Yeah. If you're a uni-cheek, I guess.
Yeah.
Well, thank you so much for spending some time with us, Common Country
thank you for
Boys.
having me. It
That
was
was
fun.
so nice. What a gentleman from Indiana and has come to Bakersfield. How long have you been here now?
I've been in Bakersfield for 5 years.
5 years.
Yes.
My
I've been in
God.
California for 12 years.
Yeah, because you were at Loma Linda
Yes,
for
I
a
was
long
there.
time. Well, that is fabulous. Give them a call again. What's the number now to call Butology?
327-3800.
327-3800. And you can make an appointment, and the consultation is free.
That's
Amen?
correct. Yes.
So you can come in and ask all the questions in the privacy. You don't have to do it on radio.
Yep.
Did I miss anything?
I don't think so. I think we've pretty much covered everything there. By the way, they're over. Butology is, we teamed up with them for a couple of Concert Express buses that we had a lot of fun with, and they're right over there on Commerce, over by the AAA building. But again, 327-3800. Dr. Lehocky, thank you so much for joining us today.
You.
And thank you for bringing in the stress thingy.
Yes,
ball
right.
And
device.
I might mention to you that a lot of people say they want the Gradowitz nose. Okay, it is a perfect nose, and a lot of times
I noticed that.
Yeah, cosmetologists will stop me on the road and they go, "Can I take a mold of that nose?" I try to avail
squeeze that
myself.
one more time before you go.
If you squeeze that implant, I am
No
so
comment.
out of here, people.